There are more measles cases in Ontario alone than all of the US combined. Cases climbing in Alberta and Manitoba, over 100 hospitalized. And now, an infant is dead after being infected with measles.
Measles is preventable. It was eliminated from Canada decades ago. So how did we get here, and why is it so hard to end this outbreak? The first thing you should know about measles, it really is one of the most contagious diseases known to humankind. Say I have the measles. Anyone who comes into this room after I'm done yabbering here is at high risk of getting infected, even hours after I leave the room. Unless, of course, everyone was vaccinated.
The end product of medicine's long match with measles.
And if everybody eventually is vaccinated with 2 doses, we feel that we can probably eradicate measles altogether.
It's better than getting the disease and ending up sicker than just a little pinch, So.
And enough of us did get vaccinated. That's how we eliminated the virus almost 30 years ago, meaning we got rid of community spread. But there have always been pockets of people who have not gotten vaccinated, and the virus is burning through those pockets right now. In this current measles outbreak, the embers started flying at a Mennonite wedding in New Brunswick in October. Someone there from abroad had measles, who then infected others. The outbreak fizzled out in New Brunswick, but in Ontario, it just kept going.
Why do we need to screen for measles here?
We need to ensure that we give them the right measures in order to protect potential patients that are inside that room.
The epicenter is here in southwestern Ontario. The worst and the most complex cases get referred to this hospital.
We are seeing little babies who are admitted because they have high fevers, they are dehydrated, they need fluid resuscitation. But we are also seeing probably the most common complication is pneumonia, respiratory infection.
This doctor also talks with families about why they're hesitant to get vaccinated. Sometimes it's as simple as reassuring them that this is a safe, effective vaccine. But other times, it's much more complicated, like if their community rejects the shots.
You need to get down to what the cultural issues are, and you might not even get very far if it's really deeply ingrained, especially if the community looks up to its leaders. You may get more from dealing with the leaders.
Anyone who isn't immunized is at risk of contracting the virus. But Ontario's top doctor has said it's been spreading primarily in Mennonite communities, with historically low vaccination rates.
I know our medical officers of health, our frontline nurses, our primary care providers have worked for decades with them to try to provide support, to try to ensure that they take advantage of vaccines. But in some instances, particularly in these communities in the Southwest, the uptake has been exceptionally low.
Mennonites are a hugely diverse group, but many of those who live in southwestern Ontario belong to the old order, horse and buggy, rural, communal.
Because we are a pacifist community, governments haven't always liked us because we're not going to fight for them. And so we have a long history of just asking to be left alone.
This Mennonite pastor is on the progressive end of the spectrum. He's not of the old order and he believes in vaccines. But he also has a good sense why some other congregations reject it.
For some people, it's been set up as a false dichotomy. And so to get vaccinated is a sign of mistrust or misfaith in God. And thus, so if team vaccine is competing against faith with God, well, team vaccine loses every time. There's also a part where, and this is for all of us, when something becomes part of our identity, it becomes very hard. We don't change our identities.
And while it may be hitting this community hard, the measles outbreak isn't just confined to the community.
I sleep like a baby.
Neither is vaccine hesitancy. And with so much misinformation on the internet about the jab, there are fears the number of people vulnerable and sick is only going to rise. Emergency rooms are already adjusting.
I never expected to see measles in my lifetime.
This is a dry run of a procedure that's now become necessary in this children's ER.
Ready?
To avoid a measles exposure in the waiting room, filled with vulnerable kids.
For the first cases, when children were quite unwell, people in the ED were very stressed out. One, very worried about how contagious these children were to other patients in our department and to themselves.
So this is the negative pressure room. This is the measles room.
And each measles case stretches an already overburdened healthcare system even further.
Every single measles case, it's hard for the person who has measles. It's hard for the family. It's hard for the doctor and the nurse that are taking care of that patient. It also involves a whole bunch of extra work for all of the rest of the system. And when they're doing that, they aren't able to provide care for other conditions, other people who need attention.
Those on the front line say it's going to be really difficult to get this outbreak under control. It's going to take a combination approach, talking one-on-one with families that are hesitant to get the jab, talking to those community leaders and establishing that trust, combating misinformation online, and establishing measures so that those who are infected can safely be treated.
That might sound really overwhelming, but experts believe we can take these measures and bring measles under control.